Hi, my name is Dr. Kim Chronister. I'm a licensed clinical psychologist and I specialize in mood disorders and personality disorders. Narcissistic personality disorder is in the DSM, which is the psychiatric manual. It's a pervasive personality disorder, which means it impairs a major functioning area of life, like a job or a relationship. It's typically pervasive, meaning it's long-lasting, typically not curable. The way that it's typically cured is if someone has enough consequences that they're motivated to change. However, that's not typically the case, unfortunately, and it does affect a lot of people around them, especially their loved ones. A narcissist is typically not filled up inside. However, they do project confidence to the world. If they have no regard for others, then they meet full criteria for narcissistic personality disorder. If they just kind of need admiration and don't actually have the lack of regard, then they just simply have narcissistic traits, not full-blown personality disorder. A narcissist is externally validated. They require feedback, they require attention and admiration. Many narcissists are very successful. They're lawyers, they're doctors, they're CEOs. They require a lot of external attention. They typically do not take criticism well, so one way to figure out if someone's a narcissist is to give them some constructive criticism and see if they can digest it. However, unfortunately, they a lot of times lash out. They can become mentally and emotionally abusive. They also need narcissistic supply, which is that external validation, that attention, whether it's from social media, fame, success, admiration, etc. If they're externally validated, then they feel filled up in the moment. However, that's fleeting. That's not long-lasting, so they're constantly requiring more and more admiration, attention, affection, stimulation, etc. They typically want fame, fortune, success. They need some kind of an ego supply, and an ego supply could actually be the partner, a loved one. Once the partner is no longer as interested in this narcissist, then the narcissist starts to either stray or lash out. This is when they can become emotionally abusive. The same sort of thing applies to a sociopath, whereas they have no regard for others, therefore they will do anything to get their way. Typically, a sociopath is more motivated by money. A narcissist simply needs admiration. Gaslighting is a technique that narcissists use on a regular basis typically, and that basically means making the other person feel pathological or wrong in some way. So that means it kind of deflects and takes attention off of them, whereas they are the pathological ones. They're going to manipulate the situation and make their partner, loved one, coworker, friend, etc. feel like they're the pathological ones. There's something wrong with them. They're typically very manipulative, they're typically also very intelligent, and this is what makes it very difficult to kind of get past and get over a narcissist. A narcissist would rather be dead than have no external validation. This is really important to remember when you're dating a narcissist or you're trying to figure out the red flags of a narcissist. What I recommend with someone that's trying to get over or get beyond a relationship with a narcissist is to actually join a support group, an NPD support group, and not only group therapy, but also engage in individual therapy, because there's going to be so much damage done by the time you're done with being with a narcissist that you're going to need your own mental health work. Individual group therapy is what I recommend. Just understand you'll probably need a safety plan at minimum, because remember, these people don't have regard. They're going to become very reactive when you try to leave them. You're going to need your support system, and a solid one at that.